Right, let's talk about back pain. Back pain is one of the most common reasons why people take time off work. A lot of people come to me asking, Doctor, what's causing my back pain? What test can I do to find out what's causing my back pain? And how do I manage my back pain? Back pain can be due to several causes. You can have back pain due to something as little as bending to pick up a key. Lifting doesn't have to be heavy items. You can have back pain from lifting medium items as well. And it's usually due to incorrect lifting as opposed to how heavy the item is. Weight gain can cause back pain as well. Also, if you have weakness of the core muscles of your back, that can also trigger back pain. Pregnancy can cause back pain because the weight of the baby is pressing on the lower spine. That can cause back pain. At work, you might be someone who does a lot of sitting, a lot of standing, as well as having poor posture during the sitting or standing positions, or maybe you've had an injury while playing sports or due to a fall. Now, these are the several many causes of back pain, but you can also have medical causes of back pain, such as osteoporosis. This is thinning of the bones, which can be due to use of steroids, for example, can cause osteoporosis. Old age, especially in women, if you are going through the menopause and you lose estrogen, that predisposes you to having a risk of osteoporosis. Or if you had a hysterectomy, maybe in your 40s, then you're at a higher risk of having osteoporosis. Also, vitamin D deficiency can cause back pain. So if you have pain in your back, think, could it be vitamin D deficiency that's causing my back pain? Kidney stones can cause back pain, especially in one side of the back. So you might have right-sided lower back pain or left-sided lower back pain, and that could be due to a kidney stone. Also think of other causes such as tumors can cause back pain, or cancers that have spread to the back. Could be a primary cancer such as breast, prostate cancer that has spread to the back, or you could have a blood cancer such as myeloma, which can also present with back pain. Now you should check out my video on red flag symptoms that will tell you if your back pain is more serious than just a muscle pull. So in terms of tests, what you want to know is, what can I do to find out what's causing my back pain? Well, you want to start with blood tests. For example, I mentioned vitamin D deficiency. So you want to check your vitamin D. You want to check your calcium level, especially for women going through the menopause, women who've had early hysterectomy. If you have low calcium, that can also cause low vitamin D, which can also cause back pain. Doing other tests like full blood count, for example, if you're anemic, that tells you there might be something underlying that's triggering your back pain. If you have raised white cell count, could this be some sort of cancer that's causing my back pain? Also, a raised white cell count can also be due to an infection or inflammation that might be triggering back pain. There are other causes of back pain which I didn't mention, such as ankylosing spondylitis, and that's an inflammation of the spine that can also cause back pain. Apart from blood tests, there are scans that you can also do, such as an X-ray of your back. We'll look at the structures of your bones and your discs, and that will tell you if there is a wear and tear of your discs as well. You can also have an MRI scan or a CT scan of your back that will give you more detailed information as to what's happening with your back. Is it a bulging disc? Has my disc come out? Or is it pressing on a nerve? Is it causing a pain that might be going down to my legs? Because in some cases you might have symptoms of back pain which might present as sciatica, where basically you have pain radiating down your buttocks, down the hips and down into the leg, and you can present with numbness and tingling of your toes as well. In terms of management, we usually advise conservative management. So for example, heat is very important for back pain. Even lying in a hot water bath for 20 minutes will be a lot of help for your back, as it helps to relax the muscles in your back. Using a hot water bottle, even when in bed, will help with your back, or applying a heat patch or DP gel can help with your back muscles. Or you can apply an anti-inflammatory gel such as ibuprofen or Voltaren gel, which would also help relieve pain and relax the muscles of your back. Some cases your doctor might want to give you a muscle relaxant called diazepam, which helps to relax the muscles in your back. This is usually given for a short-term period because diazepam can be quite addictive, and so it's not usually given for more than 3 to 4 days. In terms of painkillers, most people find paracetamol and ibuprofen might help. But in some cases, paracetamol and ibuprofen might not help, especially if your back pain is quite severe. So you might benefit from taking stronger painkillers such as cocodamol. 30/500 is the strongest dose of cocodamol you can get. And you can take that combined with ibuprofen. If you need something stronger, your GP can prescribe you with another anti-inflammatory called naproxen. This can be taken in combination with cocodamol. However, beware with naproxen, it is quite a strong anti-inflammatory and it can burn the lining of your stomach. So ideally, if you're going to take naproxen, you should take it with a stomach protector such as omeprazole tablets, for example. Omeprazole tablets help to protect the lining of your stomach, which limits the damage which can be done by naproxen. Taking painkillers allows you to do exercises such as stretches and back exercises. You can check the link in my description below for exercises that you can do to help with back pain. If you find that you're taking painkillers, you're resting from physical activities, you're doing stretches and exercises that has not helped, you might need to consider maybe going for some physiotherapy or osteopath or chiropractor. Now, a lot of people ask, which is the best I should go for? Is it a physiotherapist? Is it an osteopath? Or is it a chiropractor? Now, the answer to that is that there is no best. It's usually a personal preference as they all work together to achieve the same goal. I mean, there is slight difference between three of them. I'm not going to go into that much detail. Perhaps I'll do another video on the difference between physiotherapists, osteopath and chiropractors. But chiropractors, focus more on the neck and back. Osteopaths tend to focus more on the whole body, while the physios help with stretches and exercises as well. Now, if you've tried physiotherapy, osteopaths, chiropractor, and all the other things we've mentioned, again, that has not helped, the next step would now be to see an orthopedic back specialist. Now, orthopedic back specialists are basically back surgeons, and what they do is they do investigations that we spoke about, the blood test, the MRIs, the scans, and that's assuming that your GP has not already sent you for these tests. They will look at the results and they will determine what the best treatment would be. Would it be conservative management? Would it be a trial of steroid injections for the back? Steroid injections are quite good for the back. Again, I'm going to do a video on steroid injections for the back. However, there are pros and cons of taking steroid injections for the back. Another option that we're looking at, which is usually the last option, basically you have to be crawling on your knees to have this option, and that's back surgery. Back surgery can be quite relieving for those who have debilitating back pain. However, back surgery can cause problems somewhere else. Like, I know someone who had back surgery for lower back pain, which helped with the back, but then had numbness of the left leg, which was a permanent problem. So back surgery is not something that's taken very lightly. So on the whole, management of back pain, conservative management, rest, painkillers, stretches and exercises, heat, physio, seeing an orthopedic specialist. And then if that doesn't help, you're done for. Now, if you have any questions, feel free to drop any comments and subscribe to my channel.